My name is Dr. Torabi. I'm an interventional cardiologist at Franciscan Physician Network, and I'm at the Crown Point and Munster campuses. Certainly, if anyone is having heart palpitations, I think it's always important to get it checked out, particularly if they find it problematic. If it's an occasional skipped heartbeat and they really are not finding all that problematic, it's probably something that's okay. I'd still encourage them to let their primary care provider know about it. But having just one glass of wine and having a heart palpitation, I think you'd be hard pressed to sort of kind of put it in, one big red ribbon and say that it was from that glass of wine. So I think certainly in medicine, we always recommend that everything in moderation. And certainly though, if that is, let's say we have somebody that's having frequent heart palpitations and, we do a workup and they wear a heart monitor, whether it's for 48 hours or for a week or 2 weeks, if we detect an abnormal heart rhythm, say atrial fibrillation, that's very common in the general population, then really unfortunately, having that glass of wine is probably not the best thing to do, particularly for that arrhythmia, because we know that it can increase the recurrence. There's a well-known phenomena known as holiday heart. But again, that you're not getting holiday heart from a glass of wine. That's probably for somebody that's probably having too much to drink.